Well, good afternoon. It's Ed Ullman, the pharmacist up on the Wellness Center on the mountaintop of Tannersville, New York. We all take a breath because we've now begun to talk of slowly opening up our economy. And we shall begin to slowly reemerge from the shadows. The key markers that will help determine the reopening process, especially in New York State where we've been hit so hard, it's going to be number one is going to be regional planning and coordination. Now, this is critical, and I'm really happy to see the governors of our surrounding states on the same page with Governor Cuomo. Because if one person opens up a park and the other ones don't, they're just going to have a migration from one state to the next state, and now we're back into the same problem. So they have to regionally coordinate how they're going to do this, how they're going to reopen, and how do they keep people at home in their state the best way that they can, and this is happening. The second is the way that we're going to be measuring the transmission of the virus. And there's no one formula for this. Every community is in a different position. Every state is in a different position. So this is why we have to be very, very careful on how it's done. The first one, as you all been reading about, is the hospital admission reductions. Now, the CDC has a target that's unrealistic for most communities to meet. And it says we want to see 14 straight days of decreasing admissions, and then you're okay to reopen. And that's just not going to be the reality. So the states take that as recommendation, but they have to use their other wisdom. But they'll be watching that, and it's important. In the last 20 days, we've dropped our number of deaths in New York State by half, which is great. And so New York is going to be looking at that very carefully, and I know the governor is right now. We're then going to look at the level of testing. Now, everyone is reading about when are the tests going to come. This week we got notified that pharmacists in New York State, 5,000 pharmacies, will be allowed to do testing of the coronavirus. I got to wait for the details, but that's a good a sign for us. Overall, we're anticipating by next week that we'll be doing somewhere about 25,000 tests a day in New York State. This week we had a total of 1.2 million tests that were done throughout the United States. And as we've discussed before, testing is important even if you have no symptoms, because the testing allows us to then identify and track who else might have been exposed to the virus, and it's probably one of the most successful ways to reduce transmission. And then the last thing is we're going to be looking at the antibody testing. Now, at this point in time, we still have unreliable testing kits that are coming out. They still have not been totally proven. We're waiting for guidance on that. But in general, what we want to be able to do is to test the blood or the serum of an individual to see have they built up antibodies by being exposed to the virus. And these antibodies will be there even if they had no symptoms. And what we're trying to do is to say, okay, we now know what percentage of people were exposed to the virus in any particular community. So in New York City, for instance, their early testing is showing that 13% of everyone in the metropolitan area has been exposed to the virus. In upstate, on the other hand, we're looking at 4% so far. So these are the things which will determine the rate of transmission, which will also determine the aggressiveness of the reopening of activities. And then one other one that I think is so important is the fear factor. I don't think most people have had a chance to really process the feeling of losing control, the feeling of being isolated, the feeling of being away from human connection. And we don't know how we will come back and re-engage into normal society, if there is anything as a normal society. So how we manage the fear factor, I think, is going to have a lot to do with how we reopen our economy. The governor reported that the phase 1 reopening will begin after May 15th. And it will start with, as you probably have heard, about upstate manufacturing and construction industry, or other companies that might not have high levels of contact with other individuals. We also know that any business that does want to reopen will have to have a plan in place on demonstrating what are they going to do for, in effect, for prevention to try to reduce the risk of infections going forward as an operating business. Once we start to move through phase one, we'll move into phase two, which is the most critical one, and that's the opening or the reopening of our schools. And each school district is going to have some tough decisions to make there. In the overall United States, we're seeing now over 1 million reported positive cases, 1 million. And we have a fatality rate or death rate of 6.1% in the United States. That's up from 4.3% just 10 days ago, and then 10 days prior to that it was 1.2%. So you can see the ugliness that has come even though the wave has been reduced. In New York State, we had 300,000 reported positive cases so far, or basically New York State, led by the metropolitan area, has had 30% of all the positive cases in the United States. Our fatality rate, though, this last week is about 6%, which is not much different than it was 5.4% about 10 days ago. So that's actually a very good sign for us. And in Greene County here, we had 114 confirmed positive cases, and we did report our first 2 deaths. I would like, and last week I was very happy to be able to get questions from our patients, and so I thought maybe I would do a little of that again today. The first question was, as Greene County officials, have they been successful in trying to spread the virus in our community? And I can say unequivocally, I think they've done an excellent job. I think we had a little bit of a rush a few weeks ago when we had many individuals coming up from the city, other states coming to our parks and so on, coming up here in the B&Bs. But that was only for a relatively short time, and then we started to see a settling in of individuals that were coming up more with second homes and basically convalescing here. But overall, I think if we look at the village and the towns and the county and the coordination with the medical personnel and with the hospital and with the state officials, I think we've done an excellent job, and I think they should be applauded for keeping people safe the best that they can in our county. Second question was if I have confirmed antibodies for the virus. So I have my antibodies say, yes, you had the virus. Do I have lifetime protection? No guarantee. We just don't know about the virus enough. We do not know, and nobody can tell you whether or not the antibodies will give you protection from getting infected again. Will the protection last for a year? Will the protection last for multi-years? Or will be a lifetime protection and then be reinforced when we have a vaccination? We don't know, but it's a very good question. And what exactly is herd immunity? It's H-E-R-D. Now, this is fascinating because herd immunity means that a nation in particular would turn around and say, you know, we want to see us have a total immunity to the virus, but we need to have a high number, maybe a majority of our citizens get the virus, develop the antibodies, and now we, as a majority of a nation, will have less opportunity for a virus to spread. That's the goal for herd immunity. And what's fascinating, and several of the Scandinavian nations, they're smaller than us, so it's different. They have a different healthcare system, but they are taking this approach. And what they do is they isolate and identify all the individuals in a community that has compromised immune systems, or they have high-risk cases like being at the nursing homes and so on. They try to keep them social distance from everything. They try to make sure that they have adequate testing, they make sure they have adequate prevention, and they then try to keep the spread from occurring. The general population, including the social population as well as the working population, continue to operate and are being exposed to the virus, and their goal is that's how they're going to build up this herd immunity. But good question. What about this new drug, Remdesivir? Well, you've probably been hearing about this antiviral medication, and this is coming off of when we heard about hydroxychloroquine. Now, this new one is promising, and I want you to understand that when a drug is generally tested by the FDA, it sometimes takes 10 years for it to be approved. So we're going with very little evidence and very little studies here to try to get a handle on the coronavirus. But this new medication, the antiviral, they've used it for HIV patients, has been promising. And what they're seeing is that for someone who is very high risk, who is in a late stage of the disease, that they can reduce the duration of time by about a third of how long that individual would be having the virus in them. So it's promising, and we need to continue on hydroxychloroquine. We still do not have any evidence. There can be cardiovascular problems, but we'll still have our finger on the pulse. The last question was, what's going to be the biggest challenges moving forward? I guess this is my own personal observations. And I think the biggest challenge is that we have to be prepared for another surge that can occur in any region, any place, and we need to be able to move very rapidly and not over fear ourselves, but to be able to know that this is going to occur and be there on top of it and move quick. And I think the way we deal with each other and emotional and mental health issues that will occur and be exacerbated because of this, those are the biggest challenges that I see. And then, of course, with the economy and getting our lives back. The next few weeks are going to be challenging for all of us. Yeah, checks are now coming. Others are in the mail. The stories of caring and helping each other have been incredible. And we are always continuing telling you, keep the immune system strong, use basic common sense protection of cleaning your hands and the mask and so on, and social distancing until we have experts to tell us other guidance that we can do. And but let's just use our wisdom. And I do want to take a moment very much just to thank our staff that is hanging in there and basically doing the best that we can. Our volunteers that have helped us have been enormous, and a big thank you. And I want to say a loud thank you to everyone who have been calling up to say, how can I help? They're making contributions to our Patient Assistance Fund. I want to give a big shout out to the Onteora Club and Twilight Club, who went out of their way and wrote letters to their members saying to give Wellness RX help with their Patient Assistance Fund because they can help others. They're right with boots on the ground. And I want to thank one young lady that came in and said, I just got my $1,200 check from the government. And she goes, I want the Patient Assistance Fund to have it. And it just brings tears to your eyes with that generosity. That's what kind of a week that we've had. We've been able to give free masks. We've been able to aggressively help others. And we're going to do our best that we can. Let's hang strong together. I'll see you next week.